Good to see everyone again. I'm Emily Beauregard. I'm the Director of Kentucky Voices for Health and a member of the Thrive Kentucky campaign. We appreciate everyone making time for this webinar today, and we'll be going over a lot of state and federal policy updates. I was just talking with somebody before this call, and they said it's 10 years in a week right now, and I think that is apt. It feels like there's just a lot happening all at once. And a lot of updates since we last had a webinar in January. So we'll get to those soon. Let's go to the next slide, Alex. For those of you joining us for the first time, if you're not familiar with the work of Thrive Kentucky, our mission is to meet the basic needs of every Kentuckian through systemic change, because we recognize that many of our fellow Kentuckians have faced historic barriers to meeting those basic needs. And you can see the principles that guide our work on this slide deck, or on this slide. We will be sharing the slide deck with you in a follow-up email. So if you want to kind of read through those, you're welcome to. On the next slide, you'll see all of our Thrive partners, the organizations that make up Thrive. And if you're interested in learning more about any of our organizations, those are hyperlinks that you can go to. So we can go to the next slide. If any organization is interested in supporting this work by becoming a sponsor, we would welcome that. And we are actively taking sponsorships now. You can reach out to Kelly Tolby for more information about what that looks like. We have a flyer and some additional information about, the programming, the schedule, and so on, how many people attend. And we would love to have a good lineup of sponsors for 2025. We can go to the next slide. Here is the agenda, or not the agenda, the schedule for Thrive for 2025 for our series of both webinars and in-person roadshow events. So we will be, after the legislative session ends, we'll be hitting the road and doing our roadshow around Kentucky, which we always love to do, just to really get to know more about the communities that are really active in this work, and the folks who are on the ground every day serving Kentuckians, helping their neighbors navigate complicated public assistance programs and safety net resources. So if you're interested, please put these dates on your calendars. We'll have more details about locations and other registration information out soon. We can go to the next slide. Here's the agenda for today. We'll be covering quite a few updates, as we normally do. And before we get started, if we can go to the next slide, just some quick housekeeping. We have a lot of folks with us today, which is fantastic, but we do want to keep everybody muted while we're speaking. If you have a question, you can put that question in the chat. Raise your hand if it seems like there's something that needs to be clarified, but otherwise we'll keep everybody muted. We are, like I said, sending out the slide deck from today. We'll send out the recording and any other materials that come up along the way in our presentation. We'll also be sending out an evaluation, and we want you to keep your eye out for that, because we really do like to have your feedback. And if you are a certified community health worker or a social worker and you'd like to receive CEUs for attending today's webinar, then you will need to complete that evaluation in order to get those CEUs. But we hope that everybody will take some time to give us their feedback. And like I said, if you have a question, please put it in the chat, a comment. We'd like to address those as we go. We find that that's a little easier to do than waiting until the end. And if there's something we don't get to in the next 90 minutes, we'll send that in a follow-up email as well. We can go to the next slide, Alex. I'm actually going to get us started with a federal update. There's just a little bit happening right now at the federal level. I'm not going to be able to cover all of it, I will say. I know the last state and federal update that we had at the end of January came on the heels of the Trump administration coming into office, but some executive orders and a federal funding freeze that I think had a lot of folks probably participating in this call really wondering what was going to happen with federal grants that you or organizations that you work with rely on, some of the programs that are, very actively being funded here in Kentucky. And while we know that there's, a lot held up right now in the courts, and a lot of uncertainty still, we won't be touching on, that aspect of the federal update right now. I think, though, that it really has created a chilling effect. It's created a lot of uncertainty, and all of that, is kind of bleeding over into the work that we're doing here at the state level as well. Just to acknowledge that. We can go to the next slide. What I'm going to focus on today is what's happening in Congress. I think everyone here has probably heard that Congress is looking to make major budget cuts in order to provide, the revenue they would need to also extend tax cuts. But these tax cuts would go to primarily the top 1% of earners in Kentucky or in the United States, and they would be offset by major cuts to programs like SNAP, Medicaid, and other public assistance that would have just devastating effects here in Kentucky. And to just give you a sense of what's at stake, and this is not an exhaustive list by any means, food assistance provided through SNAP is on the chopping block. The number of households getting rental assistance could decrease. Health coverage through Medicaid and subsidized marketplace plans that help people to afford their insurance. Those are absolutely a target right now. Tax credits to U.S. citizen children whose parents lack a Social Security number. Cash assistance through the Temporary Assistance for Needy Families, or the TANF program. Here in Kentucky, we call that KTAP. And then SSI benefits for low-income families with more than one disabled individual. And so what you see is potentially $230 billion being looked at, in terms of SNAP funding, and almost $1 trillion in Medicaid funding is on part of the target right now. We can go to the next slide. So when we think about what that could mean for Kentucky and just putting it into context, 1 in 3 Kentuckians use Medicaid for their health care. And I'm going to focus in on Medicaid now because that's really the area that I'm most familiar with, and also the area that has the biggest target. And the map that you see here shows you the percentage of enrollment by county, which is going to be really important for our advocacy work because people, not only Kentucky voters, but our policymakers, our decision makers, they really want to understand the local impact. Our, elected leaders want to understand which constituents are going to be affected, what that's going to look like on the ground in their communities. And so the more we can talk about, the impact at a county level, I think the more people will really start to understand what this could mean. But of that 1 in 3 Kentuckians, that's about 1.4 million people. More than 600,000 are kids. And these kids, that's more than half of the kids in Kentucky who are covered by Medicaid. And 1 in 2 kids with special needs are covered by Medicaid. Nearly 100,000 Kentuckians access health plans through the Kentucky Marketplace, what we call Connect. And most of those individuals get some amount of subsidy, some amount of cost sharing. We call them enhanced premium tax credits. And those enhanced credits right now are also at risk of not being extended, which would make health insurance plans much, much more expensive next year. And finally, something to kind of put in context as well, when you look at our entire state budget, the general fund, that's about $14 billion. Kentucky, or Medicaid, I should say, brings in just over $14 billion in federal funding into Kentucky every year, so slightly more than our entire state budget. We can go to the next slide. So again, and we've talked a lot about the uncertainty and the fact that it's really hard to understand how this process is going to unfold, and at what point in time these cuts may actually be up for a vote in Congress. There was a vote in the House last week on February 25th, which was, pretty simple, a budget resolution, which essentially was Congress or the House saying, we want to cut these sort of big targets out of these parts of the budget. But they didn't go into detail in terms of what programs would be cut or who, would be directly impacted by those. So the resolution is, one step that needs to be taken by the House. The Senate would then need to also pass their own resolution. And then what comes next is they have to kind of get down to business, really focusing on kind of the nuts and bolts of what that looks like, what the real cuts would be, and to which programs and what parts of the budget. And that could take a while. In fact, first we were hearing that might start really in earnest in April, but now we're hearing it might be more in the summer. So there's a lot of time for us to continue to put pressure on Congress and to make sure that they understand the impact in Kentucky, what's at stake, and to hear from us that we don't want these cuts. But at the same time, as the Congress is moving forward with budget reconciliation, that's what this process is called, because they've chosen this vehicle because it only requires a simple majority vote. They are also looking at a federal government funding deadline. Our current budget will run out on March 14th. That's the deadline for Congress to pass a continuing resolution to extend funding. Now, they could do that for a month. They could do it for 3 months. But that's essentially just buying more time so that Congress can continue to negotiate what a budget for fiscal year 25 would look like. But we are expecting that, in the next 2 weeks or even less than 2 weeks now, there's going to be, attention, focused really on this extension. There is a potential for a shutdown if there's no agreement. But assuming that, they get to some agreement, there'll be an extension of some amount of time in which we'll have to continue also advocating for, a budget that is going to continue to fund all of these vital programs. And then I put in here 2 recesses that Congress will be taking, one in March and one in April. And these are great opportunities to reach out to your members of Congress when they're in district, try to have some meetings. And we're going to be doing the same here at Kentucky Voices for Health. We can go to the next slide. Just again, to talk a little bit more about the impact on Kentucky in terms of, what some specific cuts might look like. If Congress ended our federal state match for Medicaid expansion, which is higher than our traditional match, and that means that, right now for Medicaid expansion, the federal government puts 90 cents in for every 10 cents that Kentucky has to put up to cover expansion members. That totals 478,900 Kentuckians at the moment. If that match went down to our traditional match of about 71 cents from the federal government on the dollar, then our uninsurance rate would double here in Kentucky, or our state would have to put up an additional $1.1 billion and perhaps more than that in order to keep Medicaid expansion. And we simply don't have that kind of money here in Kentucky without raising taxes. So that's one scenario. Another is something called per capita caps, where the federal government would change how they do their funding allocation to states and put a price on, for each person enrolled, this is how much we're going to give you, regardless of whether it costs more for that person to, to take care of those individuals, or if there's some unexpected pandemic or natural disaster. And over time, Kentucky would have to put in more and more of the money. The federal amount of money would shrink. Kentucky would have to put up more, or we would end up seeing a big decline in Medicaid enrollment. So any way you slice it, whether it's capping Medicaid, whether it's ending expansion, imposing work reporting requirements, which we hear is a very popular option right now on the table for a lot of Republicans in Congress, but we know what it really means is fewer people covered, and we have to continue to talk about it that way. We can go to the next slide. So it's important for everyone to be reaching out to your federal policymakers. Like I said, this is not going to be a short-term kind of process that ends here in March. This is going to be going into the next few months. But we really need to keep up the pressure. We need to make sure that they're hearing from us. And you can see all their contact information here on this slide. And we are putting together our own toolkit with Kentucky data that we'll be sharing soon. With that, I'm going to turn it over to Dr. Sheila Schuster to give us a state update on legislative activities.
Thank you, Emily, and hello, everyone. I'm sorry my camera's not working, so you'll have to just imagine what I look like. Next slide, please, Alex. So just wanted to remind you that we're in a 30-day session. We are going on to day 18, so we're more than halfway through, and this gives you the calendar. We've passed the last day for new House and Senate bills to be introduced, and we've got just this week and next week before the legislature adjourns for the veto days, and that's March 15th to the 26th. And then they will come back on March 27th and 28th for the last 2 days of the session. Next, please, Alex. So these are some bills that we mentioned in our January webinar, and I just wanted to update you. We were talking about House Bill 1, that was the first bill that was passed, and it reduced our state income tax from 4% to 3.5%. And Dustin did a great job of telling us what that meant in terms of reduced revenue to the state. It's been signed into law by Governor Beshear. A bill that is moving, that many of us have a lot of concern about, is House Bill 16, which would remove fluoride from the water if the local water district decided to do that. So they're going with a kind of local control. It passed the House last week, 68 to 29, and it's moved on to the Senate. A bill that KVH and some other advocates have been working on is to improve the non-emergency medical transportation. When we do our road shows, we probably hear more about NEMT and housing than we do anything else. This bill, though, does not look like it's moving and has not had a committee hearing yet. Freestanding birth centers has been a topic of discussion in the legislature for the past 5 sessions, I believe. Last year, the House bill moved out of the House but did not get through the Senate. This year, the Senate version, Senator Funky Promeyer, passed early in the session on February 7th, and it is poised to move through the House. So you can see that vote was very positive for it. A local landlord exemption from lead abatement enforcement has not yet been heard in committee. And again, we have some concerns about that. There were 2 bills that were filed that would give some exceptions to the abortion law that's in effect right now, but neither has had a committee hearing yet. And I don't think the Senate bill has even been assigned to a committee. Senate Bill 13 is Senator Meredith's perennial bill to limit the number of MCOs in Medicaid in Kentucky to 3. And it always passes the Senate. It did again this year unanimously. And then hardly ever, well, it's never moved in the House. And we'll see whether the House is changing its mind on it this time. Senate Bill 23 has moved through quickly and has been signed into law. It gives some legislative autonomy with regard to executive authority. There's lots of back and forth between the Republican legislature and the Democratic administration, and this is an example of one of those bills. A bill that would give religious organizations exemptions for providing affordable housing easily passed the Senate, and it has gone on to the House. And I think maybe Adrian is going to talk further about that in the housing section. Next, please, Alex. So here are some bills that are good that we're hoping will move along. Senate Bill 789 changes the way that Medicaid would be overseen. It creates a beneficiaries advisory council, which we think is a very good thing. It would be made up solely of past and present Medicaid members, their parents or guardians, and their caretakers, either paid or unpaid. And it would make some changes to the MAC, to the representation on the MAC, and it would put terms into the TACs, the technical advisory committees, And I'm hoping that this bill is going to move along, but it has not been heard yet in Health Services Committee in the House. House Bill 422 also deals with administrative regulations, and it has passed the committee and is posted for passage in the House. House Bill 79 is a bill that many of us have been working on for a number of years. This is Representative Moser's bill, and it would require the licensure boards to really get more helpful information so we could really determine what the healthcare workforce is here in Kentucky. I always use myself as an example. I've been a licensed psychologist since 1973. I'd like to say I started when I was 10, but that's probably not quite accurate. But I have not practiced clinically since 2000. I keep up my licensure by doing the CEs that are required and so forth, because when I testify in Frankfurt, I want them to know that I'm a licensed psychologist. But I'm counted as a member of the workforce, which is really misleading since I'm not practicing. So this bill is going to ask the licensees, are you working? Are you working full-time or part-time? Where are you working? Because only one address is listed with the licensure board, and we want to know where those services are being provided. What is your specialty area and some of those things? And it passed unanimously and has gone over to the Senate. Another bill that we've worked on for a couple of years, this is probably the 4th or 5th year, is a bill that would give some relief from insurance or MCO imposed limitation called prior authorization. And if you're a good provider and you've mostly had your requests for services authorized by the insurance company, then you would be given a kind of gold card. It's kind of like passing go and collecting your $200 and not having to pay the fee. So it passed 91 to nothing, and it's going to be heard tomorrow, actually, in the Senate Banking and Insurance Committee. A bill to try to improve the workforce and dental services would allow licensed dental hygienists who right now work only in the health departments to also work in the federally qualified health centers. And it passed unanimously in the House and has gone to the Senate. A really important bill that people with disabilities have been working on for a number of years is Senate Bill 26. It protects the rights of parents and guardians with disabilities. They have been discriminated against, unfortunately, in parenting or in adopting. And this has passed the Senate 37 to nothing, has already passed the House committee, and is going to be voted on probably later this week or next week in the House. And then a bill that makes sexual extortion a crime and requires education of parents and children passed unanimously in the Senate and has gone on to the House Judiciary Committee. Next, please. These are good bills that are not moving, so that's the bad part of it. House Bill 3 would require Medicaid to reimburse pharmacists for administering injectable medications in the mental health field. These are long-acting injectables that people with severe mental illness have. And if they have to go someplace else to get the shot, they often kind of get lost and don't get there. So we really would like to see this pass. House Bill 58 allows a renter with a medical condition to move into more appropriate housing without being penalized for breaking the lease, which is a situation that arises more often than you would think and would be very helpful. House Bill 244 would provide insurance coverage for treatment of eating disorders. Eating disorders are deadly disorders that children and adolescent young adults have, both males and females. In Kentucky, we have a real shortage of treatment facilities. We do not have any residential treatment facilities in Kentucky, and it's very hard for people to get services. House Bill 426 and Senate Bill 94 are companion bills. They would ban the awful practice of something that's called conversion therapy, which is really not therapy. It's really torture. It's trying to convince kids through very negative means that they really are not gay. Senate Bill 32 from Senator David Yates provides a range of benefits for veterans in employment, housing, and healthcare. This is maybe the second or third year that he's proposed this. Newly elected Senator Keturah Herron from Louisville has a bill to require insurers to offer an annual mental health wellness exam. We all get a physical exam that is paid for by our insurers, and we want to have parity and have people get a mental health wellness exam. And then Senate Bill 90 would restore some of the school functions and prohibitions that were removed in Senate Bill 150 in 2023. It's late in the session, and probably these bills are not going to move to passage, but they are all good ideas, we think, and we would like to see them see the light of day maybe next session. And next, Alex. And then we have some bills that we are concerned about. The first two have to do with changes in Medicaid oversight. House Bill 695 will be heard in House Appropriations and Revenue tomorrow. And it really is kind of a philosophical, if you will, change of control over the money in Medicaid and who makes the decision. Concerned that waivers and some of the things that the cabinet needs to move in a timely manner on would be delayed with the requirements that are in this bill. House Bill 9 would reestablish a Medicaid oversight and advisory board, and it may have been heard in committee. That may be outdated information, but we're looking for that to move along. House Bill 398 loosens the occupational safety hazard safeguards for workers. There was a lot of floor debate. You can see from that vote, 62 to 33 in the House, and it has gone on to the Senate. A bill that purports to be religious freedom passed the Senate 29 to 7. The concerns are that it could possibly undo the local ordinances that protect LGBT citizens from discrimination in housing and hiring that are passed by local municipalities could be undone by this. House Bill 495 is of great concern because it actually would protect those who do conversion therapy. It passed the House State Government Committee last week, and it's posted for passage in the House this week. It actually takes away the power of the licensure boards to discipline these people. House Bill 4 would prohibit diversity, equity, and inclusion in post-secondary schools, and it will be heard tomorrow in the House Post-Secondary Education Committee. This has been a topic that is quite controversial, as you probably know. Senate Bill 20 and House Bill 6 are companion bills to, they would require a major economic impact review of all administrative regulations. And they both are moving along in the committees in their respective chambers. And Senate Bill 132 has been around for the past 4 or 5 sessions. It's really a dangerous bill. It allows providers or anybody that's in a healthcare facility to actually deny medical services to anyone on the basis of their conscience, whatever they say. If they don't like the way you look or the color of your skin, or if you come in holding the hand of a same-sex partner or something, then somebody can say, no, we're not going to serve you. Next, please. So just remember, we don't have a vote in 2025, but we do have your voice. And you really need to be speaking up and speaking up often and getting our younger people ready to get registered as soon as they turn 18 and be ready to vote, because 2026 will be a very busy year for elections. Next, please. We have an accessibility guide, and you can access it this way or when you get the slides through that link. And it gives you everything from changes in parking to literally getting in and out of the buildings and the different rules inside. So we hope that that makes it easier for you to get to Frankfort and to be a part of the democratic process. Next, please, Alex. Oh, now I'm ready to turn it over to my friend Dustin Pugel.
Thank you, Dr. Schuster. Again, my name is Dustin Pugel. I'm the policy director at the Kentucky Center for Economic Policy. And there is a lot going on that includes with our workforce as a whole. And we always like to start in part going over this just to kind of lay the groundwork for where the needs are, right, within our state and how or to what extent folks are going to need those based off of how the economy is running in general. I also like to start with this slide because too often the notion that people don't want to work is used as a justification for cutting really vital programs that help a lot of us in a lot of different ways. And so this list here is a clipping from every decade going back to 1894 with some version of the phrase "nobody wants to work anymore," which I always enjoy because, of course, people want to work. So let's move on to the next slide. In fact, people have been returning to work for years now, following the COVID downturn, which was really severe. In fact, it was 3 times deeper than the downturn during the Great Recession. People returned to their jobs in record numbers, and we're actually now 5% above where we were prior to the pandemic. That's a far faster recovery than any of the previous recessions we have on record. And it's in large part due to a lot of really quick action taken on the federal and state level to keep people whole while they were recovering from a really devastating downturn and obviously a pandemic. Now, what's interesting, I don't have it on this slide, is that people want to work so badly that actually our unemployment rate has increased by a full percentage point over the last year. It went from about 4.3 to 5.2% through the course of 2024, which means there's actually about 22,000 more people who are actively looking for a job but can't find one right now. Now, that's not super concerning just yet. A lot of that is folks who are re-entering the workforce after not working and just looking for a job, but it is something to kind of keep our eye on moving forward. So let's go on to the next slide. The prime age group, in fact, we call them the prime age Kentuckians, who are in the workforce. So these are folks between 25 years old and 54 years old, are actually working at record numbers. So this, actually, I forgot to update this chart, but there are actually more people now in this age group working than ever have before, and a larger share of this age group. It's actually pretty close to the national average. So when it comes to the primary folks we think of as being working age, they are on the job. And I think that shows in a lot of ways. Let's move to the next slide. Now, interestingly, when it comes to folks who are not currently working, but who are in this age category, there's a survey that asks, what is it? What is it that's keeping you from being in the labor market? And unsurprisingly, the main reasons why these folks are not working are they're ill or disabled. Kentucky actually has the second highest rate of disability in the country. We have the #1 rate of lung cancer deaths, #2 for cancer detection. We have a lot of folks with chronic conditions, or folks are not working because they're at home taking care of a loved one. This could be a young child. So I think a lot of us have heard about the difficulty finding or affording childcare lately. But also it could be staying at home caring for someone who has a disability or an illness. The remainder are either going to school, they're retired, or they're actively looking for work. A very small percentage of the total are not working for some reason that the survey couldn't identify, about 21,000 folks. So let's move on to the next slide. When you break that out by gender, what we find is that men are slightly more likely to be ill or disabled. Men are also more likely to be going to school, whereas women are more likely to be at home taking care of their home or a loved one. And again, this feels like in some ways common sense, but the data really does show that there are a lot of women who are not in the workforce right now, primarily because they're caretakers. Now, that's labor that they're not being compensated for, right? But that is something we could be compensating people for. So later when we talk about things like childcare, if we talk about things like home and community-based services, those are folks who are freeing up others who may want to be in the workforce, but can't do that right now because they can't afford care for someone that they love. So let's move on to the next slide. The primary increase in folks leaving the workforce. So often you'll hear this term, the labor force participation rate. This is just the percent of the population 16 and up. So that labor force participation rate has been slowly declining over the last 10 years. And the primary driver for that is an increasing number of people who are retiring. Retirement is really being driven by the share of the labor force that are aging into that age group. So if you look at folks who are 65 and older in Kentucky, in 2010, they represented about 13% of the state. By 2023, it was nearly 18% of the state. So that is a really large share of folks. And again, it's common sense. Baby boomers make up a large portion of the population, and they're getting older, and they should deserve to retire. Other categories, such as going to school, not being able to find work, taking care of a home or a family member, those have all been pretty stable. Interestingly, the number of folks who are out of the workforce because they're ill or disabled has gone down, and that's two reasons. One, a lot of those folks moved out of that category and into retirement. And two, we actually are doing a better job as an economy, as a society, providing accommodations for people with disabilities who want to be on the job. It's also no coincidence that that decline started after we expanded Medicaid. When we were able to get chronic conditions under control for a lot of folks, provide things like glasses that are really necessary for a lot of jobs, people were able to enter back into the workforce. All right, let's move on to the next slide. When we look at the geography of work participation, it's also really important to point out that when we talk about our relatively low workforce participation as a state, what we're really talking about is Eastern Kentucky. Eastern Kentucky is a place that has been dependent on one sector for a really long time. That sector was, for decades, it was logging, and then starting at the turn of the century, it was coal. And then starting in the 50s, when we started to industrialize, a lot of folks were laid off. And then finally, sort of at the turn of this century, when we started moving toward things like natural gas and renewable energy sources, coal mining plummeted. And so what has resulted is a whole region that has been underinvested and has had chronic unemployment for decades now. When we look at the balance of the rest of the state, so sort of I-75 and westward, the workforce participation rate is basically the same as the rest of the countries. So it's really important when you hear legislators talk about a low workforce participation rate, whether they realize it or not, what they're referring to is Eastern Kentucky. And what Eastern Kentucky doesn't need is cut benefits. They need more investment, and they need more job opportunities. Let's move on to the next slide. Now, even if you have a job, that doesn't necessarily mean it's easy to get by as a state. We have a lot of low wage work in this state. And even though wages have been rising in recent years, even faster than inflation, it's still the case that if you have kids, it's really difficult to afford to live. So this chart is one of my favorites. That dotted yellow line shows what the median annual earnings are for a full-time worker year round. And the darker those blue bars get, that represents the more kids you have. The first set is for one adult. The second is for a two adult household with only one working, so the other one gets to stay home with kids. And then the third set of bars is for two adults both working. That means you're going to need childcare. And it's no surprise to any parent or grandparent on this call, the more kids you have, the more expensive it is to just exist in the world. And so according to the MIT living wage calculator, this is what that looks like in a practical sense. Half of Kentucky families earn below that yellow line. And so it's really difficult, especially for young families, to be able to afford all the things that we need to just get by. So with that, we're going to shift gears a little and move on to a couple comments about where we are right now with our state budget and some recent decisions we've made around the income tax. So let's move on to the next slide. So as Dr. Schuster mentioned at the beginning, there has been a pretty consistent effort by the part of the General Assembly to cut our income tax at 0.5 percentage point at a time. There's a certain formula or certain triggers that they have to meet based off of how much revenue we're bringing in and how much we're spending, and also how much we have in our state's savings account called the Budget Reserve Trust Fund. And what's happened since 2018 is we took what was then a progressive income tax where wealthier people paid a higher rate. We flattened it to 5%, which had a sort of revenue negative impact. And since 2022, we have reduced the income tax at a 0.5 percentage point at a time. Each 0.5 percentage point reduction, while that doesn't sound like a lot, represents about $700 million. And I'm going to make some comparisons later to kind of show just how much that is. Because we've reduced it 3 times now, that's about 2.1 billion less per year than we were bringing in before. So if we just simply went back to the status quo of a 5% income tax here in the state, we would have $2 billion more to spend on the priorities and needs that we have as a Commonwealth. It's going to be difficult to continue to cut into our income tax without budget cuts. So what we noticed in the 2026 budget is that they've basically evened it out. Instead of having a lot of extra money, which is required to be able to cut the income tax, they basically budgeted what they plan to bring in. So that begs the question, are they going to continue to try and cut the income tax? And if so, what's going to be on the chopping block? Let's move on to the next slide. I also think it's really important just to point out that the primary beneficiaries of an income tax cut are our wealthiest neighbors in the state. So nearly 2/3 of the total value of each income tax cut goes to the top 20% of earners in the state. The bottom million Kentuckians will see no benefit from an income tax cut because they don't pay an income tax. We have a specific deduction that provides for particularly families and very low income families, and so they don't pay an income tax. Where this really goes is toward top earners. If you just look at the top 1% of earners in Kentucky, these are folks who earn a minimum of $500,000 a year. On average, they earn about 1.4 million per year. They will get about 20% of the total value of this tax cut, or roughly $5,500 per 0.5 percentage point cut. So they're the primary sort of winners from this. But if we move to the next slide, and we look at where we're currently budgeting as a state, the #1 budget category is P through 12 education. Now, there were several attempts in recent years to cut that part of the budget, specifically through more recently through Amendment 2, which would have provided for a voucher program that likely would have used the existing education budget to prop up that program, and therefore cut away at public education. Obviously, Amendment 2 did not pass, and so in many ways that category is politically protected, right? You don't want to go after a type of service that was just overwhelmingly approved of by the general public. So the next largest category of spending is what? It's Medicaid, right? And so let's move on to the next slide. If we compare the value of the tax cuts that we have already made up to this point, so that $2.1 billion or $2,881 million, that's a large amount of money. It is more than we put toward K through 12 SEEK base funding, and it's nearly as much as we're spending on Medicaid, right? So we're talking about an enormous amount of money. It's double what we spend on all of our public colleges, universities, and community colleges combined. So it's going to be, like I said at the beginning, very difficult for them to continue to cut more and reduce our revenue more without starting to eat into some of these other budget categories. And Medicaid obviously now has a big target on its back. Let's move on to the next slide. I just want to say a couple more things about Medicaid because it is such a big part of our budget, but it's also such an important driver in our healthcare and our economy. We put together a couple pieces on this recently, and I'll drop them in the chat later. But I want to start by saying that while Congress is looking at Medicaid, the General Assembly may be as well. The problem with this is that Medicaid is a really good deal for Kentucky. Kentucky is one of the states that pays a much lower share of Medicaid than other states. And so if you look at this chart, the yellow bars there at the bottom are inflation adjusted state investments in Medicaid. And the dark blue bar are inflation adjusted federal investments in Medicaid. So we get around $3, just shy of $3 from the federal government for every $1 that we spend as a state. And that money is really important, not only because it covers 1 in 3 Kentuckians and make sure that they can go to the doctor and get the kind of care they need to be able to get and stay well, and including hundreds of thousands of working Kentuckians. But if we go to the next slide, it's also extremely important because it props up a lot of jobs in Kentucky. So these two lines represent, the top one is private hospitals and what are called ambulatory care centers. These are other types of healthcare services, think like dentists and MRI clinics and other services like that. It stayed pretty consistent. You know, it had a drop off like basically every other industry did following COVID-19, but it recovered within a year and has stayed very strong since then. The dark gray line below it is every other sector in our economy as a state. And it has not been able to keep up. In fact, it's had a lot of dips through the years, and it certainly has not performed as strongly as healthcare. These are jobs in every county in Kentucky, and they're pretty well-paying jobs that then use those dollars in their local economies, right? They buy a house, they buy a car, they buy clothing, they send their kids to summer camp, they pay local taxes, they pay state taxes. And so as we move forward and thinking through Medicaid's importance in our economy and sort of choosing Medicaid instead of tax cuts that primarily benefit the wealthy, it's things like these that I think we're going to continue to come back to and try and really understand to be able to protect this really vital service. So with that, I'm going to hand it over to Jordan to talk a little bit about food assistance.
Yeah, and if you notice me talking in a muted tone, it's not because I don't care or I'm not fired up about this. I'm in a coffee shop and I don't want to get everyone else too riled up about it. So yeah, this is our chance to discuss nutrition assistance and primarily SNAP and WIC. Next slide. So we have a number of ways that we like to target hunger throughout the United States. And the most notable, of course, is the Supplemental Nutrition Assistance Program, formerly known as SNAP. You can see the gross and net income poverty lines that are our thresholds to qualify for this program. And U.S. citizens and some legal residents of the United States may receive SNAP benefits. Non-citizens can apply on behalf of their citizen children. So obviously there are implications if the current administration is able to do away with birthright citizenship. That will have ramifications for non-citizen parents applying for these benefits. And Women, Infants, and Children program is a cousin or sister program, I should say, to SNAP. You can qualify by being pregnant, breastfeeding, or postpartum, or a caretaker of a child under 6. So just because you don't have to be a woman in order to qualify for WIC is the easiest way to explain it. It also has a poverty level threshold to qualify for this nutrition assistance program. Outside of things like SNAP and WIC, we've got the National School Lunch Program with its own poverty line, but we also have categorical eligibility. You'll hear discussions of things like Community Eligibility Program, which will certify that a school can receive free school meals based off the number of kids participating in low-income programs like SNAP or Medicaid. So anytime you hear a discussion of restricting or driving down participation in things like Medicaid or SNAP, it has a ripple effect. It is an axe swing that will fell many trees, and it will impact the number of kids that are able to eat at home and at school. In a similar vein to both the school lunch program and SNAP, we have summer EBT, and this is for households with school-age kids over the age of 6 participating in NSLP and that have kids under the age of 6 enrolled in SNAP. So summertime is obviously rough for low-income families. Their children are not able to rely on the meals provided at school, and this is to meet that gap. It is a way for them to eat even when school is out. Next slide. With the recent national disaster, effective immediately, FNS has approved a waiver requesting the allowance of hot food products prepared for immediate consumption. One of the things not covered under SNAP, you cannot buy hot food items, but occasionally in cases like this where there are natural disasters or a really pressing need, you can submit a waiver. And the waiver is currently approved through March 27th. It will aid residents who have relocated to temporary housing arrangements who can't store or prepare meals with canned items or veggies that they're able to get with their cards. So this waiver is really crucial right now in times of need, and we like to see it. So next slide. Summer EBT has ended for 2024. Like I said, it provides additional grocery money during summer to address seasonal food insecurity. It provides an estimated $120 per child to an estimated 580,000 kids in Kentucky. So a recurring theme you'll find is anytime you look at the amount of money that's being allocated, it is supplemental. It does not cover the entire grocery bill, nor is it meant to. It is a chunk of change, don't get me wrong, and it does go a long way for these families. It is life-changing assistance that helps them get back on their feet, but it is truly supplemental. So anytime you hear accusations of people using the safety net as a hammock, you need to remind them that it's not the case. This sort of thing helps people graduate off the program. These are programs that are designed to help get people off of them, and they go a long way to doing just that. So in 2024, households with kids receiving SNAP, Medicaid, KTAP received benefits in June of 2024. 2024, the benefits were different from 2025. So last year it was $120 per student. In 2025, it'll be $40 per month per child. So shifting to a different model, and we'll see what it looks like in 2026. Next slide. Average SNAP benefit is $174 per month for the individual, and for household $370. And if you know the cost of groceries these days, no matter how much you're scraping by, it's going to be truly supplemental. But it allows families to focus on putting away money. That way they can get off the program and be self-sufficient. It lifts people up by their bootstraps in the most American way possible. The total number of SNAP participants as of June was 617,000, almost 618,000. And 13.7% of Kentuckians were participating as of last June. We spent around $1.2 billion in Kentucky on in SNAP, which is a huge stimulus for our economy. It is federal dollars coming in and rejuvenating local businesses that are accepting this money for a number of products. So it's quite important to our economies. Kentucky is 46th in the nation for SNAP participation rate, though. Only 65% of eligible folks are actually participating. This number is far too low, and I know the Cabinet for Health and Family Services is working overtime to try and get these numbers up. Next slide. There are work exemptions. There are 3 new ones that started back in September of 2023. People experiencing homelessness, people aging out of foster care, and veterans. And the existing exemptions, if you're under 18 or over 54, child in household, or pregnant. So we do have exemptions. And then there are also exempted counties if you're physically or mentally unfit for work, caring for an incapacitated person, substance use treatment, etc. So there are a number of waivers that allow folks to exist on the program without having to work for it, which, as Dustin mentioned in the last section, work requirements are a hot topic right now. There's a lot of fear being generated that people are sitting on the program for far too long, but statistically, Kentuckians are on the program for 8 months or less. So that isn't the case. We just need to dispel more disinformation. Next slide. And then another narrative you'll hear to attack SNAP is SNAP fraud, but intentional SNAP fraud is less than 1/4 of 1%. So very, very few cases of it. And in each appropriations bill since 2023, we've attempted to get some reimbursements for the folks that are getting their SNAP skimmed at the register, because they are victims. We've got vulnerable members of our population just trying to buy groceries and they are getting screwed out of it. And we would like the federal government to help pony up for the reimbursement. And we're optimistic that we'll be able to land that in a future piece of legislation. We'll see what happens though. It's a matter of priority rather than a matter of policy. Next slide. And then WIC, as I mentioned, helps feed pregnant or breastfeeding women, infants, and children under 5. And the total April 2024 participation was 106,000 with average monthly benefit of only $43. Stretches a lot less far than SNAP, but usually someone who's on WIC is also going to be participating in SNAP. And it also only reaches around 60% of eligible families. So again, we need to get those that participation rate a lot higher. Next slide. Yes, so before I get to resources to help with food assistance, I wanted to flag for y'all that there are a number of federal proposed cuts to these programs being bandied about. The House budget resolution directed the Department of Agriculture to find $250 billion in cuts. And suspiciously, $250 billion in cuts is the exact price tag for eliminating the Thrifty Food Plan, which back in 2021, previously SNAP benefits only scaled with inflation, but the Thrifty Food Plan made it scale according to a healthy diet as well. And a rollback of this program would end up saving the federal government about $250 billion over the next few years. So kind of suspicious that they put that cost estimate on the cuts they needed to direct. But what this translates to is a lot less money in the Kentucky economy, and every single SNAP user across America would lose about 25% of their SNAP benefits. So in the rising cost of goods and services, it's going to cost even more to pay for your grocery bill. So there are a number of other things being bandied about, work requirements, asset tests, and we're going to keep you informed of all of those. So the last thing is the resources. If you want to look at our resource map, food banks, similar emergency food assistance programs, be happy to direct you to those myself. I work for Feeding Kentucky, love it there, and we do a lot of good work with our network of partner agencies. And you can also connect with SNAP Connectors, the Kentucky WIC website, and Senior Meals for deliverables and pickups for food insecure seniors. Next slide. And I'll pass it off to my good colleague, Adrienne Bush.
Thanks, Jordan. Hi, everyone. I'm the Executive Director at the Homeless and Housing Coalition. And yes, I am Adrienne Bush. Next slide. Okay, so yes, a little bit has been happening on the federal level. I highlighted a few things here. One is our FY fiscal year 24 homeless assistance and continuum of care grant renewals and new projects are in a limbo, where awards were announced in January prior to the new administration coming on, but these awards are not under contract now. So this poses significant disruption to projects who are currently housing people experiencing homelessness and would like to be able to continue to do that, as well as house more folks. We are also hearing reports about projects that were housing redevelopment funded under the bipartisan infrastructure law, but those have been paused. And as Emily alluded to, we have the current year budget FY25 under a continuing resolution expiring in less than 2 weeks. Depending on what sort of deals get worked out, we may be facing severe cuts to homeless, to rental assistance, and to housing development grants as well. And then lastly, we have seen multiple media reports of a proposed staffing reduction at HUD, or the Department of Housing and Urban Development. About 50%, and that 84% of that 50% is expected to be cut from the Office of Community Planning and Development, which is where disaster recovery money is. It flows through homeless assistance, housing development, all sorts of programs that we care about. We're working with the National Low Income Housing Coalition. There are a couple of sign-ons. There is one that is an organizational one that the deadline is today. So I'm going to drop that in the chat if you are so inclined. Next slide. All right, so with the state legislative update, just a refresher that the legislature did establish a housing task force to meet through June through November of 2024 to study and review the current and future policy needs of the state to address access and availability of housing. Next slide. So you may ask what kind of bills are emerging from the task force and potentially moving the session. One of them is Senate Bill 59, Yes in God's Backyard, which would streamline planning and zoning requirements for religious institutions to develop affordable housing. This has passed the Senate. It's awaiting a House committee assignment. Then we have House Bill 160, which would create parity in local zoning requirements for manufactured housing. It has passed the House. It is waiting a Senate committee assignment. Senate Bill 25 would amend KRS 103.200 to include multifamily housing development of 48 units or more in the definition of building for sections related to industrial revenue bonds by Senator Mills. This has passed the Senate, waiting a House committee assignment. This just happened towards the end of last week. Next slide. As a sort of companion to Senate Bill 25, if you listen to what I just said and said, what is that? We have Senate Bill 50 that would create new sections of KRS Chapter 65 to establish a process for a local government to establish a residential infrastructure development district. It has also passed the Senate, is awaiting a House committee assignment. Part of the issue with housing is that some of the places where we have land, we don't necessarily have infrastructure. We're trying to marry the two things. Senate Bill 129 by Senator Rocky Adams. This would reform, revise, update. There is a tax delinquency diversion program that is operational in Jefferson County with vacant and abandoned properties. This would allow nonprofits whose primary purpose is to develop housing that is affordable to be able to obtain those properties rather than just have them sit there vacant and abandoned. There is also an additional bill relating to homelessness, which would simply streamline regulations on food donations to emergency shelters. Next slide. All right, some of our priority bills aren't quite moving as quickly as we would like them to. One is House Bill 588, which would modernize and index the fee structure that funds the Affordable Housing Trust Fund. This was filed by Representative Bratcher from Elizabethtown. This is something that happens outside of the budget, and the fee structure has not been updated since 2007. In the meantime, the number of units that we need has gone drastically up. House Bill 534 is record sealing for dismissed evictions and expungement for minors improperly listed in a filing, filed by also Representative Whitten. And that has been assigned to the House Judiciary Committee. Next slide. All right, so then we have a few bills that propose additional barriers. One is House Bill 18, which is a local mandate for additional requirements for multifamily and accessory dwelling units. It extends the moratorium on Louisville's Land Development Code through April of 27. It has passed House Local Government and awaiting a House floor vote. House Bill 10 creates new criminal penalties for squatters. It's passed House Judiciary and awaiting a House floor vote. House Bill 173 would preempt local governments from operating rental and lead registries. This is on the agenda for the House Local Government Committee tomorrow. House Resolution 24 is a simple resolution. It would direct the General Assembly to transmit a letter to the federal government urging them to repeal the continuum of care and block grant homeless assistance. It is also located in House Local Government. And Senate Bill 110 would create a new section of KRS Chapter 100 to prohibit a local government from requiring the operator of a short-term rental to obtain a conditional use permit or imposing density-based restrictions on short-term rentals. Next slide. All right, but there are so many good housing bills. There are too many to count here on the slide and in this time amount. So I wanted to point out there is a Homenibus bill that was filed by Representative Watkins and Representative Burke that is an idea of all of the many things that were presented at the Housing Task Force, during the Housing Task Force, and some outside of the Housing Task Force. That would involve creating a loan pool, a homelessness prevention fund, a housing state credit, energy efficient housing credits, a surtax on short-term rentals, where the proceeds would go to the Affordable Housing Trust Fund. Sorry about that. Full eviction expungement and sealing, and all this would come with a price tag of about $104 million from the Budget Reserve Trust Fund. Next slide. All right, and then I wanted to take a moment to talk about the ongoing response to flooding. Jordan had mentioned the hot food waiver, and so I'm glad he did. But in addition to that, we also have a FEMA declaration that includes individual assistance and public assistance for emergency work in 11 counties in Eastern Kentucky. If you know of people who may qualify, think they may qualify, please check out that link. That is the disaster number 4860. They can apply online. Secondly, given that Eastern Kentucky is recovering from the flooding in 21 and 22, you may ask, what are we thinking about long-term housing assistance? There is an open community development block grant, disaster recovery grant, assuming, again, that DOJ and the Trump administration don't rescind those funds or freeze them. People can apply for housing now. People who were affected by this flood can still apply for housing now using that link. And then there is disaster unemployment assistance available as well, according to the governor's office. And with that, I will turn it over to Dr. Schuster to tell us about behavioral health and waiver updates.
Thank you very much, Adrienne. And I'm wearing two hats today. My organization is the Advocacy Action Network, that is the Kentucky Mental Health Coalition and the 874K Disabilities Coalition. And I also am a longtime board member and officer of Mental Health America of Kentucky, which is MHA is the longest serving mental health advocacy organization in the country. So they are really great at getting out there with public education, prevention measures, and so forth. And we'll mention them throughout the slides. Next, please, Alex. So one of the things that we've been working on for the past 5 years or so are Medicaid waivers. The waivers are developed for specialized populations, and they provide services that are not covered in traditional Medicaid. And one of the populations that has never had a waiver are the people with severe mental illness. So that would be schizophrenia, schizoaffective disorder, bipolar disorder, and so forth. So we have been working on, it's actually not a waiver, it's a state plan amendment to get supported housing is the main thing that we want to get for people. If you talk to any of the family members in NAMI, National Alliance on Mental Illness, they will say that getting housing for their loved ones where they have the supports to keep them in recovery, to remind them to take their medications, to get them to their therapy services and so forth is what's really needed. We were so hopeful, so hopeful that it would be approved by CMS, the Center for Medicare and Medicaid Services, before the end of 2024 and before the administrations changed, but we didn't quite make it. So it's kind of hanging in limbo out there in the netherworld. CMS has it, but is not authorized to act on it yet. And we are still hoping, and the Department for Behavioral Health that's kind of shepherding this process is still hoping that we will get it approved and we can start it on July of this year. Another population that has been most in need of a Medicaid waiver, and this one has been approved, are Kentuckians with mental illness or substance use disorders who are incarcerated. And what happens is that Medicaid traditionally gets suspended when a member is in jail or prison. And this is a waiver to provide Medicaid services while they are still incarcerated, to get them going in their recovery process, to get them hooked up with their MCO so that within 6 months of their release from jail or prison, or I just lost it, juvenile justice detention, so that they can enter into the community and there's a seamless transition into services. So this has been approved, and we're looking for full implementation of that in October of 2025. So very, very exciting. Next, please. So I want to remind you that the health of our lesbian, gay, bisexual, trans, and questioning students has been very much at risk since the 2023 session, when Senate Bill 150 was passed. It negatively impacted the physical and mental health of all of these students, and particularly targeted the trans students, which is doesn't make a lot of sense to me. Trans kids and trans people make up 0.6% of our population. So this is a tiny, tiny, tiny minority of students, and they need all the support and help that they can get. So one of the things that is out there is a bad practice called conversion therapy. It's actually not therapy. It's also called conversion torture. And in July, our governor issued an executive order to ban that practice. That ban is under attack with some legislation that has been filed in this session. So House Bill 64 was filed to overturn that executive order. And then House Bill 154 was filed to prohibit payment for either physical or mental health gender affirming care for trans kids. Senate Bill 150 only prohibited physical health care, did not attack mental health care. And then a really dangerous bill is House Bill 495 that's going to be voted on probably this week in the House, in the full House. And it would actually protect practitioners of conversion therapy and prohibit the licensure boards from investigating and disciplining these professionals. In other words, they're telling the licensure boards not to do what they were created for, which is to protect the public. So lots of threats to these this very vulnerable population. Next, please, Alex. So we have updated these slides on suicide and self-harm statistics. We're not doing very well in Kentucky. Between 2019 and 2023, we lost almost 4,000 Kentuckians to suicide. Most of them were white males. The highest numbers, and this is a little bit lower, younger age categories than we had seen previously, between the ages of 25 and 44. Suicide by firearm is much more frequent than all other means combined. So if you have a family member that is very depressed, that you think may be thinking about suicide, please, 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 if you have a firearm in the house, one that that person might get access to, please lock it up, please put it away, please give it to somebody else to hold during this time. If you can get past that moment of crisis, very often it does not reoccur, and the moment is past and the person is still alive. So there's alarming increases in suicide among Kentucky adolescents and college-aged Black males. Also an increase in the 55 and older population, particularly among white men over the age of 60. An interesting population that has been very affected by suicide are our farmers. We are an agricultural state, and this is worsened by increasing debt, extreme weather, uncertain prices, and isolation. This Raising Hope KY is a very positive, very preventative program, and it really reaches out to the younger people through the Future Farmers of America and the 4-H clubs to get them thinking about their mental health. LGBTQ kids are not necessarily more prone to suicide because of their sexual orientation, but because of the way that they are mistreated and stigmatized. House Bill 48, and this is really a sad piece of legislation. We just increased the amount of suicide training that we're doing in the schools from 1 time a year to 2 times a year, and we offer it for staff of 4th and 5th graders because we're seeing suicide attempts in that younger age group. This would remove that requirement for school staff to be educated about suicide prevention. So this is a huge step backwards, and I hope that we can stop that bill from going forward. Next, Alex. This is an outstanding resource. I recommend it to you all. It's updated every week, if not more often than that. The providers that are listed have to keep their information current or they're kicked off the site. You can get information with absolutely real-time availability for mental health, for substance use disorders, for recovery housing, for access to naloxone, and then it has a good number of learning materials and information. So keep that handy. It's sponsored by all of these wonderful public agencies. Some of them are part of the state and some of them are university, but they have all come together to create this great website for us. And it is something that I recommend to people all of the time. Next, please. So I hope that you know about 988. It was launched in Kentucky nationally in mid-July of 2022. I want to really shout out congratulations to Kentucky. We have one of the best systems for answering 988 because they are answered by your community mental health centers who provide services in all 120 counties. So your call is not going to be answered by somebody in Miami or somebody out in California or somebody in New York City. It's going to be answered in the area code from which you are calling. There also are shortcuts. You can dial 1 if you're a veteran, 2 if you need Spanish language, and 3 if you're a person of different sexual orientation. Next, please. So I just want to remind you, these are really, really difficult times. And I think we all feel very stressed, very afraid. If you are a person of color, if you are an immigrant or have somebody in your family that's an immigrant or refugee, if your sexual orientation is different than the norm, if you, are, unfortunately, if you're a veteran, you're not being very well protected these days. So keep an eye on yourself. You cannot be helpful to people in your community if you're not taking care of yourself. Have a trusted friend or somebody that you could go to, or maybe your primary care provider or your minister, somebody at church, who can give you some feedback on what they're seeing with you. Mental Health America has wonderful screening instruments. They have about 30 evaluations. They're completely confidential. You could take it for yourself and get a baseline, and it gives you helpful resources. So you could, if you're feeling depressed, you can take the depression screener and it will give you some idea of whether you're depressed to the point where you should be reaching out and getting some services. And I always say, when in doubt, reach out for help. The earlier you do that, the better off you are. The better it is to catch a problem early on. Next, please. Oh, there we are with Priscilla. And I welcome you, Priscilla, to tell us about Medicaid and the marketplace updates.
Thanks, Dr. Schuster. Hi, everyone. I'm Priscilla Easterling. I'm the Director of Outreach and Enrollment for Kentucky Voices for Health. So today we're going to talk about some updates. And just in the interest of time, I have a couple that I'm really going to hit hard, but if there are any questions, please feel free to add them in the chat or email me afterwards. So next slide. This is just a friendly reminder. We've talked about Medicaid renewals for almost the last 2 years now. That's crazy to think it's been that long. Adults are back on their regular annual renewal cycle, but I do want to just continue to remind folks that child renewals are supposed to start this July. We're working with the state on some outreach materials to make sure that, we have some toolkits available for individuals and families as they're sort of navigating how to make sure their kids stayed covered, make sure that their kids remain covered under Medicaid, make sure your contact information is up to date in Connect. If you need help with that, please reach out to a connector, and there'll be more information coming as we get a little bit closer. Next slide, please. The big update that we've talked about is that Anthem has exited as an MCO for Medicaid. So all members who are enrolled in Anthem were successfully transitioned to one of the 5 other MCOs. But for folks who did have Anthem, Anthem is still sort of around. So if you had any sort of prior expenses, any prior claims that weren't paid yet before January 1st, 2025, Anthem still has to cover those. They still have to process any claims for 365 days from the date of service, and they still have to respond to any appeals for services prior to January 1st. So if you need any help with that, there's a designated website that's linked there. There's a phone number specifically for former Anthem members, and again, connectors are available to help with that. And then want to call out for the dual eligibles who are enrolled in both Medicaid and Medicare, the DSNP program. That's backwards there, DSNP. They were approved for a special enrollment period that began February 1st to move their program from, yes, it does, to move their wow, I lost my words as soon as I spread that, to move their Advantage plan from Anthem to any of the other competitors. If folks did not enroll in a plan before the end of February, they were automatically enrolled in a WellCare plan for March 1st, but members still have until the end of March 31st to switch around and shop for another Advantage plans. If you need help with that, I would recommend SHIP coordinators that are available to help. You can also reach out to connectors who can make that connection for you. Next slide. Again, some examples of those notice packages. If you get them, please read through them. Make sure that you understand what they're asking for, what information needs to be submitted, and the due date for that information. If you need help, connectors are available. Next slide. All right, and here's what you do if you lose coverage. Always start with going to connect.ky.gov, or you can call the call center or work with a connector. That is really the summary of a lot of my points in the beginning here, is that connectors are just such a valuable resource that are available in all 120 counties, and they can help walk through all of these different processes. If you need any help with that, again, reach out and we'll be able to connect you with a connector in your area to help walk through some of this stuff more individually. Next slide. A good example that Medicaid enrollment has remained pretty level. Even, we saw where enrollment dropped off when the renewals first restarted, but now for the last 6-7 months, they've leveled off pretty evenly around 1.45 million Kentuckians, which is pretty exciting. Medicaid continues to be open for enrollment all year long. And yeah, we see how strong a program it is. Next slide. Okay, so a lot of this about the Anthem and any other updates, DMS does a monthly stakeholder meeting that is the 3rd Thursday of every month at 11 a.m. Eastern. You can register in the link that is there. They go through all of the updates from Department of Medicaid Services, any sort of policy or regulation changes, and they also do a partnership highlight. So they talk about a specific department under DMS who, and sort of walk through and explain what they do and how they can help. And so it's really a great time to hear directly from the state, and then also to sort of learn about the different departments and ask questions and get connected to other resources as well. So great meeting to join, and all of those live on their departmental Zoom, their department YouTube as well. So if you'd like to go back and catch up, you're just very interested in all of Medicaid policy, that's all of those Zoom meetings all live on their website as well. Next slide. And like I said, so Medicaid open enrollment is, Medicaid is always open for enrollment 365 days a year. You can apply at any time. For the marketplace, there is a set open enrollment period that closed January 15th. But outside of that, you can be eligible for special enrollment periods to get coverage at any time throughout the year. If you have any sort of life changes, we'll go through that in a second. And then Medicare open enrollment, that is also rolls through October 15th through December 7th. If you need help, connectors are available, and so are SHIP coordinators who are more for Medicare. But they can all help you navigate your health insurance options. Next slide. All right, the last thing that I really want to highlight. So this year, at the end of December 2025, the enhanced premium tax credits related to the marketplace are expiring, are scheduled to expire. And now this is part of the American Rescue Plan Act that passed back in 2022, and the Inflation Reduction Act, or 2021, and the Inflation Reduction Act that passed in 2022. These enhanced premiums, enhanced premium tax credits. They removed premiums entirely for households at or below 150% of the federal poverty line, which is around $30,000 for a family of two last year. They significantly lowered the required premium contributions for households between 150% and 400% of the federal poverty line. And then they removed the limit and allowed folks who are above 400% of the federal poverty line to become eligible for premium tax credits. And so with these premium tax credits potentially scheduled or potentially ending at the end of December, if Congress does not act, this year we had the largest open enrollment for Marketplace, 97,000 folks who were able to get enrolled in a qualified health plan, which is the second highest in open enrollment history. That if they lost those enhanced premium tax credits, the average cost of a premium would increase around $600 a month. That's a scale, but that's the average. 47,000 folks would lose their health insurance, and which would increase our uninsured rate by up to 21%. We're currently right around 4% right now. That's a huge jump. And then we estimate around 57,000 fewer people would be covered by subsidized marketplace plans, which is a decrease of 66%. So we have some great partners, national partners at Urban Institute who have done a lot of this data collection for us. And our friends at Families USA are also doing an email writing campaign. So if you are interested, please follow those links. If you have any other questions, please reach out. Next slide. So we've talked about a little bit about special enrollment periods. Those are the opportunities to get covered outside of open enrollment. There's a great one-pager that's linked here as well that goes through all of the different options that are available. Next slide. And the family fix. This is just a very good reminder for folks that if you are enrolled in employer-sponsored coverage and it seems like it might be unaffordable, you could be eligible for premium tax credits on the marketplace. There's this handy dandy one pager that's also linked here, and a quick calculation that you can do the math at home to see if marketplace coverage could be more affordable for your family than your employer-sponsored coverage. Again, if you need help with that, connectors are available, and there's a great pre-screening tool that's available on Connect. I can help do that math for you. So with that, next slide. Next slide. All right.
Thank you, Priscilla. And thank you again, everyone, for joining us today. I won't be going over all of these resources, but just know that they're here for you in case you need something quickly. You should be able to use this as a place to just go and look for the information that we've provided. And one shout out, there is an open comment period right now for paid parental leave for state employees. And so we would love for as many people to provide comments about why it's so important for our state to provide paid parental leave to their employees. And we hope, of course, that this will have an impact on other employers who see how this is really helping to support the workforce and to improve retention and so on, recruitment, retention, all the good things that you want to see in your workforce. And will also make the choice voluntarily to start extending paid leave to their employees. But please go to this link and fill it out, give us your thoughts, and we will continue to share those with the state and with legislators as this process continues. All the other resources here, I'll just say, take a look at those when you get the slide deck. You'll also be getting an email with the recording and with the evaluation that I mentioned earlier, with dates for future webinars and in-person roadshow events. And we hope to see you at one of our future events very soon. Thanks again, everyone.